Hi everyone. Today I'd like to talk to you about initiating an IV at QHC. We have certain criteria, and I already have a presentation online for you about that. I want to get into a few of the practical matters of an IV. So what I'll do is I'll show you we use the Intrasite AutoGuard cannulas by Becton Dickinson. This is a 20. You can tell by the pink coloring on the catheter. Another common size would be a 22 that we might use. There's some unique features of this catheter, so I'm just going to open this up. It's IV cannula. We're going to get into it. So when this is made, it's all made as one piece. The problem with that being sometimes when they sterilize it, it can get stuck together. So when you pull off the cap, one of the things the manufacturer suggests is that we rotate the bevel. So we're just going to rotate it just a quarter turn, just enough to loosen it. And we're going to line it back up. There's a little pink nub here. We're going to line it up with the white retract button. So that way when you get into the person's vein, you're going to be able to manipulate it. Another feature that this has is there's a septum here that prevents the flow back of blood. So once you get flash, it's called instant flash technology, but you'll see flash right in the cannula itself. And as soon as you see that, you can actually advance it just a little bit farther in, about a half a centimeter to a centimeter, and then you push retract. Well, first you actually take your non-dominant hand, guide it to the skin, then hit retract. But this button retracts back in. The needle retracts back into the shaft, so it's a safety needle. So basically, those are the features of the AutoGuard. It's a great catheter. Once we started using it, we got onto it, but there's certain techniques. One of the primary techniques is that you want to go in at about a 30-degree angle. Once you get your flash, you level out, go in about another half a centimeter to a centimeter, then take your non-dominant hand, guide it to the skin, and then you retract. So we're going to go through some of that in a minute. Just wanted to show you the features. So another thing we're going to do is whenever we do an IV, we want to make sure that we're comfortable. So I prefer, if I can, to be eye level with the patient. I think it works pretty well. You tell them what you're going to do, you lay out your supplies. During the whole process, you're basically discussing what the IV is for, what therapy they're going to use. Try to make them feel comfortable, speak in sort of a relaxed, slow tone. So for this particular gentleman, let's say Mr. Jones here, I'm going to use a metacarpal because say he's in for something like endoscopy, he's in for short term. If he was in for something longer term, I'd probably use a cephalic vein because it allows more flexion. And when I worked on surgery, we used to use it quite a bit. The main thing is you have to be 5 centimeters at least off the wrist, because there's been reports of ulnar nerve damage, so we want to avoid that. So what I'm going to do is, there's an old carpenter's term, you measure twice, you cut once. And that's exactly the way we're going to approach this. We're going to spend some time doing our assessment. We're going to avoid areas of bifurcation. We're going to look for a nice straight vein if we can. So I'm going to take a look here, and I think I've found one. So what I'm going to do, I've got this area kind of pegged out. I'm going to clean it with alcohol. And when I clean it with alcohol, I'm going to actually clean this area off. I'm going to leave it for a minute, because what that'll do is allow it to dry. If I don't do that, when I go take the cannula, the catheter, and I go right into the skin, I'm going to introduce that alcohol into the bloodstream. So it's going to be quite a stinging sensation. We want to avoid that. So I'm going to let that dry. I'm going to open up our blood flow here so we have something. So the other important thing is I'm going to put on a catheter, or put on a tourniquet. When I put on the tourniquet, I'm going to put it about 4 inches above where I'm working. So I'm not the greatest tourniquet tire in the world, but I'll put this on. I want to be able to release this as soon as I get flash. So I've got this. Even though I'm tempted to touch it again where I've palpated, I'm going to leave it. The next important thing is I'm going to do my hand washing. And I would have done hand washing prior to doing the assessment too. Let that dry for a second. Then I'm going to put on my gloves. always wear gloves. We don't know what the next possible bloodborne disease is, so we want to make sure that we're protected at all times. Anytime you're using with bodily fluids, patient's bodily fluids, you want to make sure you're protected. Okay. So I've got my spot here. I have my IV. I've loosened it off. So what I'm going to do is get nice and comfortable here. And I'm going to go in at a 30-degree angle. When I get my flash, I lower down, go in about another ½ centimeter. I'm going to take this right to the skin. And then I'm going to push retract. And now that I've got my flash, I'm going to loosen the tourniquet. So what I can do now is to stabilize this a little bit. I'm going to put a Tegaderm on. A little tricky with gloves on. But I'm going to put this Tegaderm in place to hold it. What I'm not going to do is I'm not going to go over the cannula. I'm going to attach it here. In a few minutes, I'm going to actually tape it. Another important factor here is there's a label on the Tegaderm. I'm going to label that with the date and time. I'm going to do that in a minute. So the next thing I'm going to do, if this is going to be an admitted patient, I'm going to attach an extension. So I've already primed this with a 10 cc syringe. I'm going to hook this up. An important step now, I'm just going to draw back, make sure it's patent. There you go, you can see that. I've got good flash. So now I'm going to flush it. I'm going to unhook. I have some pieces of tape prepared. So I'm just going to tape this down. And basically there you have it. Some people do a crisscross fancy taping job. I usually don't. Depends on how long the therapy's for. When I am done, I'm going to make sure I put that label on. So I'm going to fill that out. This is always tricky. I think this is where I'll lose my gloves here. I'm going to get rid of all my stuff in a minute. So I take my label that I've filled in the date and time. I'm going to put it over top of the Tegaderm, and that can stay in place for 96 hours. So now importantly, I'm going to make sure that I've got my sharps. It's retracted in here, it's still safe, but I'm still going to discard that sharps, and I'm going to clean up my mess. Okay, and that's basically it. After I'm done taking off the gloves too, I've got this way. I'm going to do hand washing again. Okay, thank you very much. Bye.